Hey guys, it's time for some awesome information. It's coffee break time with Dr. Brett. Now, over the next few weeks, we're going to start to unpack some information all about discs. Now, we've first got to find out what discs are, what do they do, what's their purpose, and what can go wrong. So discs act like spaces between the bones or the vertebrae of the spine. They're like buffers. They can help absorb pressure, but more importantly, as they give space, that space allows the nerves to exit between the bones and gives that information from brain to body at a nice, easy rate. So let's think about this. Here's a disc. I'm the spine. There's the front of your body. You've got the back. Here's one bone at the bottom, one bone at the top. Now, the way in which the spine is curved, the disc should pop out forwards within its own limitations. It's not too hard, it's just comfy for the back. But what can often happen is, what I've seen more recently over time, is because of our habitual patterns, so people texting, looking down at computers, head always forward, this poor posture, what I'm seeing more and more of these days is the neck curve changing, and which way does the disc decide to go? It goes backwards towards the spinal cord. So what then's going to happen over time? So people get symptoms. So they might get tightness in the neck, tight muscles, headaches. They might get issues lower down in the body, weak hamstrings, for example. But what happens at that level of the disc is it will start to wear and tear. It will start to degenerate. It will inflame, which can create disc problems in people. The other thing it can do over time is, if this problem remains like that for a long period of time, or if there are more unidimensional, three-dimensional problems that can occur with that disc twisting, it will lead to what's called disc bulging, and that's where the inside of the disc can start to flow out, the soft, juicy inside of the disc. The fibers on the outside can start to wear and tear, and the nucleus of that disc will start to go out. Think of it like a jam donut being squashed. That's what can start to happen. And that's where the disc will start to do something called prolapse. Look, and in saying all this can be helped. And over the next few weeks, I want to show you how disc problems can be helped conservatively. And I'll let you know on a little secret, there's one technique that's had huge success, over a 90% success rate in helping people with neck disc injuries. Can you guess which one that is? Stay tuned over the next few weeks and we'll run through how to change these issues. Take care until our next coffee break. See you soon.